everybody. Welcome to Placebo, the podcast where we talk about healthcare things. I'm Kaylin Richards, and this is my brother.
And I'm Logan Richards.
And what are you going to teach me about today?
Okay, today I want to teach you about concussions.
Oh, yes.
Okay.
Grandpa would be way into this.
Is he? Is Grandpa into concussions?
He always wants me to learn more about concussions. Why does he not talk about concussions with you? All the time he's talking about concussions.
Wow, I didn't know that. I should have called him or something.
Well, yeah.
So it turns out we actually thought that was a pretty good idea. So today on Placebo, we thought we would try out an interview. I packed up our microphones and went to talk to our grandpa about concussions.
We'll be back to our regular format next week, but for now, enjoy the interview.
Can you tell me your name and what you do?
My name is Jim Richards. I'm currently a retired athletic trainer, public school coach, and teacher.
Very nice. And how are we related?
Last time I checked was your grandpa.
I think that's probably right.
Okay.
So tell me your experience that you have working with concussions.
As a high school athletic trainer, starting from clear back in the mid-'70s, I've kind of seen the evolution of us being concerned related to concussions from nothing more than, oh, well, you just got your bell rung, sit down for 5 minutes, to now a very extensive testing program with actually immediate removal of the athlete from a game once they show any signs of possible having a concussion, having that event occur.
I've heard that saying you got your bell rung is healthcare professionals really don't like that anymore.
Correct. Because it's a pretty uninformed concept of what's actually happened to that athlete.
Yeah, it puts the wrong idea in their head. So
and in other people's heads too,
right,
around them and or even spectators and or parents.
So I figured this would be a good chance for us to talk about how concussion care has changed. Could you tell me some more highlights of what concussion care used to be like when you first started?
Well, again, back in the mid-'70s and or even earlier, I started teaching and coaching in 1960, and truly up through into the 80s during that whole time period. Again, we were in this you got your bell rung category of coaches just seeing that. Gradually, we became a little bit more aware into the mid-'70s that the athlete did have to be removed from the game in most cases and kept on the sideline until they could at least answer some routine questions about where they were playing and who the coach was and some kind of incidental things like that. And then usually we would allow them back in the game.
For football, there's a lot of talk now that the helmets don't really do much because they could even kind of increase that false sense of security. And then there's also that thing where it seems like in football, tackling with your head or using the helmet is sort of a technique. Do you know anything about that?
And originally, of course, helmets were not constructed to prevent concussions.
No.
Helmets were originally instituted to prevent fractured skulls, and we're not there for concussions. We never even thought about that early. In fact, I know for sure that when I first started playing football in the very early 50s, that I had at that time still a leather helmet, which really didn't have very much cushioning, and gradually progressed in high school to a plastic helmet, which we thought was marvelous space age invention.
Oh, you haven't gotten a skull fracture, have you?
No. But at that time, we didn't have, when we first started wearing plastic helmets, we really had no face mask at all. And nobody used mouth guards or teeth guards. Mm-hmm. And yeah, I have a nice little lump on the bridge of my nose and one false tooth in the front lower part of my mouth from diving in for a ball and being hit by something else rather hard called another guy's foot. And so gradually we have improved the equipment situation to prevent facial type injuries. But again, they really don't have anything to do with the concept of preventing concussions. As the game has changed from where football many years ago was much more of lower body contact type sport, where the tackling was much more from tackling the legs, the hips, controlling that. Blocking was all lower body. And really there was very little concept of hitting with the head. And progressively, as the speed of the game changed, so did some of the skill areas that way. And it is true that for a time period back in the 70s and 80s, where we were much more directed at using the head almost as a weapon to stop your opponent from making any further progress. So, and that's where we started to really see the increase in head injuries and brain trauma, and due to various things had to be done to correct that.
There's a lot of talk now too that you often don't know when someone gets a concussion, whereas in the past it was, well, you lost consciousness, you probably got a concussion.
Yeah, correct. And actually we know statistically right now that 95% of most diagnosed concussions do not come from loss of consciousness.
Yeah, interesting.
And so that this is a thing that we used to not really. We only looked at that. It was, well, you didn't get knocked out, so you can't really have much of an injury. And we now know that that isn't true. That the majority of the concussion problems and brain trauma are going to be present without loss of consciousness. And so there are a number of other indicators and signs that we have to be trained to look for.
What are those signs?
It's pretty obvious, and one thing that has made a huge difference, especially in the state of Washington, because we've pretty much been the leaders in concussion recognition and concussion treatment and concussion recovery protocol, due to, unfortunately, a player by the name of Zachary Lystet, who was injured in a middle school game on a repeat injury situation. And then later on, with the effort of his family, the Seattle Seahawks, the Washington State Athletic Trainers Association, the Washington legislature passed a law, the Lystet Law, in 2009, that actually takes the pressure then really off of coaches, because it's a done deal. As soon as any of the symptoms, the recognized symptoms, do appear, that athlete has to be removed from the game and can't re-enter without being cleared by a medical professional. And so we are looking immediately for headache, dizziness, nausea, blurred vision, impaired balance, and any kind of cognitive type ability that the athlete is not able to show us.
Yeah. Did you, when you were working, did you do any on-field kind of standardized tests? I know a popular one now is called the King-Devitt test, the KD test. Did you do anything like that? While
I was still active, we didn't have that test at that time, but there was definitely a protocol that we used. Oddly enough, it's almost like watching the state patrolman test for impairment while someone is driving, where clearly balance is a key factor, and being able to remember items that have occurred prior to that situation. So we originally, after the Lystet law came in, then we realized that we definitely had to have a sideline protocol laid out. And through the action of the National Athletic Trainers Association and other medical support groups, professional groups, have come up with sideline testing protocols to be used to evaluate the athlete. One of the newer methods is the impact test, which is
I did that when I was in school.
Yeah, it's a neurocognitive type testing that you do primarily on the computer for recognition and your ability to answer questions and recognize information in a given period of time. And so that we have a baseline then for the ability of the brain to function in a normal manner.
Right.
So if then the athlete does suffer some kind of a concussion event, we can then go back and retest that athlete to see how they are recovering. And so when you see in the newspaper that an athlete has had to go through the concussion protocol, then usually a test, either the impact test and or a similar one, are being used by that team's athletic trainer and or physician to assure the athlete and the coaches that are involved that that athlete is ready to go back to the field.
Yeah, we did that when I was in undergrad playing soccer. We would take the impact test on a computer before the season started. And then I remember one of my teammates one year did have to go back in. They got some type of injury and had to go back in and take it. And because of the results on the test, that was part of how they diagnosed a concussion.
Right, and it's a very valuable tool, and there is some expense involved in getting the hardware to work with it and to be able to have the computer knowledge by the person administering the test to be able to recognize how and what to do. But it certainly is a really significant tool for us in not allowing that athlete back into action too soon.
I think, have you heard of the KD test before?
Right, but had you?
We've never used that one, but that one looks like it's pretty much the gold standard now, where the person, the medical provider on the field will have a tablet computer, and they'll come out and the athlete does the test on the computer, and it even uses the camera to track eye movements and things like that, which
right.
I never heard about that.
Yeah, eye movement is becoming much more of a recognized item right now as far as how the brain is really operating. And what we previously used that way was strictly the flashlight test, where you'd shine a light in there, and if the pupils narrowed, well, he's working okay. And
right.
so we thought that was all right. But there are some other, again, very simple tracking things that I was using, again, back in the 70s and 80s, just strictly, again, just with the finger in front of the face and seeing if the eyes are tracking in the same manner on both right and left side.
Let's talk about treatment. So there's usually people bring up the analogy that, if someone tears their ACL, it's really easy to say, well, you need to rest for a certain amount of time, and then you might get the surgery, and then we'll build back up your strength. So it's really easy to talk about physical rest and rehabilitation, but a lot harder to talk about cognitive rest, especially with how unpractical that is most of the time. What did you used to do to help people recover from concussions?
Well, nothing.
Nothing at first.
Obviously, when we first really started to recognize that this was a little bit more than just you got your bell rung, that we began to recognize that a rest period was necessary, but we were looking at it considerably more as physical rest and allowing the traumatic effect to the brain to calm down. And actually, because we know that when the athlete is hit in the head, there's primarily what's called a Contra coup effect of the brain bouncing back and forth inside of the skull.
Right.
And so a lot of times the actual injury or damage to the brain will be on the opposite side from where the blow to the head actually was received. And so that can be a little confusing also if you're getting really a little more technical as to physical limitations after a possible concussion. But we're now recognizing that there are far more factors involved in concussion recovery. And so that it's not just a matter of physically resting and supposedly just like with a strained muscle, giving that the brain 2 weeks to calm down and then, okay, you're okay to go. We're now recognizing that every individual really who suffers a concussion is a different individual in that case. And some athletes recover a lot sooner, some take a little longer. We're finding that there are some things that we're now advising the injured athlete to be careful with, and one is bright lights,
Right.
which mean television, computers, games, various things like that, which we really almost have to completely rule out until the athlete is able to successfully pass the impact retest. Another kind of interesting area that it's been a little bit harder to push on is homework.
Right.
And then we're finding that more detailed, extensive homework almost has to be curtailed down to virtually nothing to, again, just like we would rest a pulled hamstring muscle, we have to rest that brain from overworking and keep its duties down to a minimum of just basic daily function and allow that brain to heal and to become ready to function in a normal manner again.
Are you talking about doing hard math problems? Like thinking too hard?
Definitely.
Okay.
Or spelling.
Spelling, whichever you find hardest.
Yeah, spelling and grammar.
Okay. Yeah, I mean, that's the issue that a lot of people bring up with treatment is that, especially in our world now, where we have to have computers to either do our jobs or do our homework or almost everything in everyday life has some type of screen. It's really hard to avoid that type of thing for a period of several weeks, which seems to be the kind of average amount of time.
Right, and another area that is kind of growing with this, we're kind of, typically thinking here the athletic trainer, the physical therapist that are working with the injured athlete on more oriented to physical skills, is now that the occupational therapist is starting to play an important role in the recovery of the injured athlete from just basic skills. And so that we're seeing teamwork of athletic trainer, PT, and now OTs working into this as a team approach to being sure that all phases of that athlete's recovery are really covered and that they are returning to a completely normal situation. And I really think that this is a spot that a lot of OTs could be getting more involved in. That this is as it's being recognized as a really essential part of the fundamental recovery, that they can play a stronger and stronger part in being sure that athlete returns to a complete recovery.
Yeah, that's interesting because there's really not a lot of in the same sense that there are with athletic trainers and physical therapists, there's not a lot of sports-focused occupational therapists. So it's like it's an area that they could be working in, but probably not many of them are are focused on.
Yeah, and I first became aware of this at a meeting discussing concussion situations. That the University of Oregon is really doing some extensive work with this, and do have an OT that is working right directly with them in the athletic training room and in their rehab situation. And again, I was just really very pleasantly surprised with seeing their inclusion in that recovery program to make it more complete, in that they weren't missing anything of primarily getting that athlete back into normal functioning manner again.
Right. Yeah, that's interesting. And it seems like because concussion is an injury to the brain, it affects almost every aspect of people instead of just one certain aspect, like an ankle sprain would. So it really takes more different types of healthcare providers in order to completely care for someone with a concussion. Okay, on a different note, I thought of another question. So for you, I'm guessing that when you were in school, there wasn't a ton of education on concussion, just based on what you've said about the development of the actual diagnosis and what we know about it. But it seems like that's almost still the case. And I read something recently that said that for physicians that are coming out of medical school, that there hasn't been formal training, focused on concussion until really just recently, the last couple of years. And I can second that. For physical therapy school right now, we really haven't had anything focusing on concussion. Do you think that that's necessary in general medical professional education, or is it something we should be learning outside of school as we kind of fall into the categories that we focus on?
Oh, well, yeah, definitely back when I first started into the athletic training area and coming from the coaching field of both football and wrestling, that, yeah, we had almost like no mention at all of other than the going back into the old get your bell rung concept of when you could see some kid kind of standing out on the field that didn't quite know what he was doing, that you said, oh yeah, well he got hit in the head, he just rung his bell, bring him out over here, take his helmet away for a little bit and let him stand. And then as soon as he could tell you his name and count backwards from 10, why, okay, you're all right, get back in the game. And so now we do know that we do have to have a lot more education. The Washington Interscholastic Activities Association does actually have some courses that they require coaches to take now related to concussions. They have a test they actually have to pass in order to be able to hold a coaching position in a school. And even some volunteer coaching organizations have adopted the same rules. So there's clearly a lot more recognition of it. The athletic trainers, because again of the work of the NATA in this concussion field, because in probably from high school up through college and professional, the certified athletic trainer is usually the first person on the scene that has to actually recognize what's going on.
Right.
And to be able to say to the coach, okay, Mary or Johnny, they're done for the day, that this is what I see. And so there's been some pretty extensive training with the athletic training field, and that's why through the Lystet law, the certified athletic trainer is one of the professional medical people that are allowed to evaluate, first of all, that the injury really does occur, and secondly, to clear that athlete to be able to come back and play again.
Well, I think if I'm remembering right, PTs are not, in the state of Washington at least, are not that one of the medical professionals that can clear a kid for return to sport. So,
yeah, that's correct. And that's, again, it's just reasonable that their basic training in college is not directed that way to the acute injury. Your expertise is in recovery and rehab. And then that's why we are now finding that in recovery that the PT does play a role in the recovery along with the OT and the athletic trainer.
Right.
But that clearly the education of starting from coaches, parents, and the athletes, and then into medical professionals has very definitely increased and deepened, and there are now some very extensive courses that can be taken related to understanding the brain injury.
Mm-hmm. Yeah, a lot of the stuff for PTs for concussion education is after you go to the PT school. It'll be post graduation kind of professional education.
Yeah,
and I think that it's that way with a lot of professions, probably except for athletic trainers who really need to have it.
Yeah, I mean that's the thing. I mean that's why Dr. Herring, that I mentioned before, has done a great deal of work with the Washington State Athletic Trainers Association and the NATA to develop programs for recognition and training the athletic trainer to be, really right on top of the scene and understanding the full concept of that brain injury and what has to be done immediately. It's pretty obvious if your player in any sport is lying on the field or the court and is unconscious, okay, we got a problem.
Yes.
But we find that a lot of players, especially the tough guy, doesn't really want to admit that they really have suffered some kind of a brain injury on the field. And so you do have to sometimes be a little bit more forceful, particularly as an athletic trainer, to examine and to recognize really what's happening, and that it's not just simply a matter of do you have a headache and or are you dizzy or do you feel like you're going to throw up?
Yeah.
That there's lots of other things that we are learning that we have to really be checking and be alert to cognitive type things. That's what I'm saying. Balance and eye movement we're now finding are very important to test for and to be sure to recognize that whether the athlete is having some kind of problem with that. I think that even before I really retired, that my individual protocol of examining for a concussion really kind of changed in that right now, the last thing I ask the athlete is, do you have a headache? I'm looking much more for balance, eye movement, recognition of some memory type items where I'll give the athlete 3 things to tell me back in a few minutes.
Right.
Some various things like that are going to tell me a lot more about what's going on inside that athlete's head.
Right. Okay. I don't know that I have any more specific questions, but is there anything else that you can think of that you want to say or that I haven't asked yet?
Well, I think that another part of the whole package is the recognition at home that
by the family or the child.
Correct. The parents, especially to start with, right after the athlete, the coach, the athletic trainer, and the sequence comes down that parents need to be more knowledgeable related to the extent of that injury and to be in full communication with the medical professionals that are working with the athlete. Because we've mentioned a couple of things here now with limitation of homework, of computer items, of computer games, bright lights, even bright sunlight. That, again, the parents need to be very definitely involved in that recovery program. And this is, where we see that from just a standpoint of wearing sunglasses in part here, that the OT begins to start to come into this, of just basic daily skills that the athlete would be involved in and advising them on how to minimize the impact on their brain.
How they need to change their normal activities in order to get the right amount of recovery.
Right, and even from the idea of driving at night when you have bright lights coming right at you. So we're discovering a number of things that way, but that very truly the parents and family of that injured athlete play a part in the recovery. They're kind of the like we say, the home guard, because again, the athletic trainer and or doctor working on it can't follow that injured athlete everywhere to see what's going on.
Yeah.
So that there are a number of things that we just have to include into a larger group that's actually working with that athlete.
All right. Well, I think that's it. Thanks for coming on the show.
Okay, that was enjoyable to go back and review a little bit and take part in a current event item.
Okay, back to Kaylin and Logan in the present now. What did you think of the interview?
I thought it was lovely. Always nice to hear from our grandpa, and I particularly enjoyed his mention of OTs, occupational therapists, which is me, what I do working with people with concussion. I understand now why he wanted to talk to me about concussions more. I didn't fully understand before.
We finally know why he talks to you about concussions and why I
Not
had
you.
never heard of it.
Okay, so that's our show for this week.
We really enjoyed having Grandpa on, but there's a lot more things about concussion that we could cover. So if you're interested in us doing more of an episode about the basics and more recent research, the kind of episode that Kayla and I have done in the past, then let us know, and we'd love to do that too.
Okay, so you can get in touch with us on our website, placebopodcast.com. There's a contact us form on there. You could also get in touch with us on Facebook. We have a Facebook page, Placebo Podcast.
And if you like the show, feel free to give us a rating on iTunes or share us with a couple of your friends.
All right, we'll have a new episode next Wednesday. That's not what I was supposed to say. What was I supposed to say?
We'll see you next Wednesday.
We'll see you next Wednesday.
Bye.